Okay, my name is Yuying, and today I'm gonna do medication administration. So I make sure that I have my MAR with me to check all the information that I need for my patient as well the medication that I need for my patients. So I go ahead and wash my hand um, and log into the computer. Okay, when logged into the computer, I will check my patient names. My patient name is Elsa Sutter, and her allergy is penicillin. And now I'm gonna look for my patient name on the computer. Okay. Okay. So before I looking for the medication for my patients, I make sure I do my six rights, which is right patient, right medication, right time, right routes, right doses, and right documentations. So I would take out the 8 o'clock medication for my patients. The first medication is digoxin. And is 0.1225 milligrams. So I need one tablet. One tablet. So this Jackson is out of stock right now, but for testing purposes, I will use this medication right here. The second medication is cephalexin, 250 milligrams. Cephalexin, right here. Yes, and I need one. But however, my patients have allergy to penicillin, and this medication is not for people who have allergy in penicillin. So what I would do is I will contact my physician or the pharmacy about this. So I won't draw this medication out. The second medications, the third medication is insulin. My patient need NPH insulin 100 units. And also she need regular insulin 8 units. Regular insulin 1. My patient have an order of influenza vaccines. She also have order of calcium carbonate and acetaminophen as needed. So I would draw it out. Each one. And calcium. Okay, I start to take out my medications. First is digoxins right here. I would make sure that I check the name and the dosage of the medications. Digoxins 0.125 milligrams. I check with the computer. That's right. I put in a med cup. The second medication, insulin, is NPH insulin. I check with the computer. NPH insulin 100 unit, NPH insulin 100 units. I'll put in my meds. The next medication would be regular insulin. So regular insulin Expiration date is good. 100 unit. 100 units. Next item is this one gonna be influenza vaccines. 0.5 milliliter. Expiration date is good. Expiration date is good. Okay. And I also want to draw the PRN medications. The next is calcium. Then this one will be acetaminophen, 325 milligrams. However, my patient need 650 milligrams, so I will draw 2. And the expiration date is good. Next item would be the calcium. Calcium is 500 milligrams. Expiration date is good. Calcium 500 milligrams. I put in my med cups right here. And at this point, I make sure to log out from the computer to protect my patient privacy. And once again, I didn't draw the cefalexin out because my patient have penicillin allergy, and this medication is not for penicillin allergy patients. I will contact a physician or my pharmacy for further information and further confirmations. Okay, now I will log out. Okay. I will go over there and prepare my medications. I also bring my MAR with me so I can do the secondary check. Okay. So right now I want to do the insulin. Draw insulin first. Take my information of my patients right here. So my blood sugar of my patient would be 352 level. So I make sure to add 8 units of regular insulin at a sliding scale into my patient regular insulin when I draw it. So before I draw it, I want to wash my hand. Here's my regular, here's NPH. I use alcohol to wipe my NPH. Regular. Okay. Here's my needle. Take my needle out. Okay, before I do anything, I want to roll my NPH first. Okay. And I want to draw air. Unit. Okay. And I will inject first air into NPH. Go straight in, inject air, and take it out. And also draw 8 units of regular, also plus 8 unit of sliding scale regular insulin, so total would be 16. 16. Okay, check 16. Now I will draw 16 unit of regular insulin into the syringe. Now I will get rid of the bubble. Okay, this one is 16 regular, and I make sure I check with my secondary nurse to make sure that I draw 16 of regular insulin unit. It's right here. Okay. And now I go ahead and draw 18 NPH of insulin. So 16, 18 is 34. So total will be 34. Unit. And make sure there's no bubble. And I also want to check with my secondary nurse to make sure that I draw 34 unit of insulin for my patients. Okay. When I'm done drawing, I want to recap my needle. There you go. And when I done recap, I want to label my insulins. Write down the name of the medication, insulin 34 unit. And today is the 18th. And time is the 4:20. And my initial. So I make sure that I label down here so I won't cover any number which make me hard time so later I can check for the unit that I need. So right now I want to draw the flu vaccines. So for flu vaccines I use 3 cc syringe and also 22 gauze and 1 inches of needle. Okay. So my flu vaccines, I need 0.5 milliliter. So I draw air 0.5 into my syringe and then check air and draw 0.5 milliliter. Okay. Okay, so I wanna check with my secondary nurse, my coworker, if it to make sure if 0.5 milliliter of flu vaccines. Okay, and then I gotta take it out and recap it. Okay, and I wanna label it. This is flu vaccine. Amount is 0.5 milliliter. Today date is February 18, and time is 4:20 p.m. and my initial. Okay, I labeled this. Okay, I want to do my secondary medication check. So I have right here is digoxin 0.125 milligrams by mouth, and 0.125 milligrams daily. The expiration date is good. The second medications, this one is acetaminophen 325 milligrams. On the other, my patient need 650 milligrams, so I need 2 of it. So 2 acetaminophen 325 milligram, 325 milligram. Expiration date is good. Put in here. The last one would be calcium, 5 calcium carbonate, calcium bicarbonate 500 milligrams, 500 milligram. Expiration date is good. I have flu vaccine, 0.5 milliliter, 0.5 milliliter. Also insulin, 34. Let's see, 8, 24, 10, 34. 20, 30. 34 unit of insulin. However, this one is 30 unit. I think I will draw the insulin again because it's not enough. I will load my NPH and then wipes. And check. First is regular insulin, 8 units, and 8 is 16 units. So 16, 14, 16. NPH 18. So I'll inject air in NPH first. Okay, and take it out and inject 16 unit of air into regular. Now I draw 16 units of regular. 16. Okay. Okay, there's no bubble, and this is 16 unit of regular because the other is a unit, and her sugar level is 325. So I draw 8 more unit of regular from sliding scale, so total would be 16 unit. I check with my secondary nurse is 16 unit, and now I'm gonna draw to my NPH right here. 34. Okay, and then there's some air here. Okay, so here is 34 unit. Okay, and then I want to recap this. Okay, and then label this. "34 units. Today date is 02/18/2020, and date be my initial." And I wanna put it down here. Okay. And I want to discard the old one. I want to discard the old one into the sharp company. Okay. I do the secondary check the last time. So I already do my orals. So now I just do my insulin would be 34 units, and flu vaccine 0.5 milliliter. Okay, now I bring all my paper and medication to my patient bedside. I would do my K-wipe. I knock on the door, wash my hand, and introduce myself. Hi, Elsa. My name is Ying, and today I'm gonna come and give you your medications. Can you tell me your name and your date of birth? So I wanna make sure I check two type of identifications, and also I check the allergic band, which have her here as penicillin. And before I give you your medication, I want to tell you what medication for you to have today. So today your medication I'm gonna give you is the Jackson's 0.5 0.125 milligrams. For this medication is gonna treat your heart failure. But the side effect gonna you will feel dizziness, headache, diarrhea, and if you experience those, it will be normal. The second thing I want to give you is your insulin, and this will be to control your blood sugar level. We this one will inject on your abdomen side, and the side effect for this would be at the sides where I give you injection, maybe a little bit of redness. Um, Also, you're gonna have influenza vaccines. This will just protect you from the flu season. The side effect that you feel soreness on your deltoid where you get injections. The last thing would be your pain medication. So before I give you your pain medication, I want to know, do you have any pain at all? Um, and she's told me that she doesn't have any pain right now, so I won't give you any pain medication, which is acetaminophen. Okay. Um, would you like to have your calcium carbonate? That is a daily supplement for calcium that you take as your as if your diet does not provide enough calcium, and I will give you that as well if you would like to. Okay, I think that would be all the medication that you gonna receive today. Before I give you any medication, I make sure I raise your bed up from 45 to 90 degree to make sure that you won't be choked when you have your medication. Okay. Okay. So right now, I wanna provide privacy to my patient. My both handrail is up. Um, First medication is the Jackson and the calcium carbonated that you said you wanted, and we won't give any as pain medicine right today. Okay, so do you okay if I give you two medicine at the same time? I also give you water. Here a sip of water, and here is the medicine. So before I go, I want to make sure that she swallow all the medication that I gave, and I dispose it. So for insulin, I would like to give you in your abdominal, and I will expose your abdominal section a little, just not much, just a little bit, and I hope you're okay with that. Okay, I'll pull this down, and expose the abdominal section. I wash my hand, put on my gloves. I want to check the area that I'm gonna give the injection. So the navel, I want to go 2 inches away from the navel onto the right side, right here. Is it okay if I give you right here? Do you have any pain or like anything? She says she doesn't have any pain. I also palpate the skin, doesn't have any swollen or redness, abnormal, nothing. So I think this would be a good side to give her. I will wipe the side. I'll wipe circular motion and outward 5 centimeter, and let it dry. As a demonstration, I will go ahead and do it on my injection pad right here. Wipe circular motion. Okay, I'll let it dry. Here's the insulin. I make sure pinch 45-degree, go straight in, stabilize, and give the medication and stabilize and take it out in this bowl in the sharp container. Okay, and I want to give her the gauze and also the bandage to stay like this. Okay, so right now I'm gonna give you the flu and flu vaccinations. For the flu vaccination, I would like to give you on your deltoid. Before I give it, I want to see your deltoid if there is any redness and any swollen. And do you feel pain or anything in this area? And she said no. So for the deltoid, I want to put one finger on the acromial process and two finger down the abdominal process, and the third finger will be the side that I'm gonna give you the medications. So I go ahead and wipe down that area. So I want to demonstrate this on the pad, the injection pad right here. So circular motion 5 centimeter outwards. Just fold this. Open the cap. So for this injection, I want to go spin the muscle and go straight 90-degree down. Because this is the vaccine, so I won't aspirate. I will stabilize the needle and give the injection with the speed of 10 seconds per 1 milliliter. So this would be 5 seconds. And stabilize and take it out. And I recap it by the sharp surface and dispose in the sharp container. So by this time, I already give you all the medication that you need today. I make sure that I stay with my patient for 5 minutes to see if there are no sudden reactions. After that, I would like to lower your bed. Make sure you feel comfortable, in a comfortable position. The hand drawer is up, over, and also give you call light. And I will come back after 30 minutes to see if you have any reaction or abnormal reaction to the medication that I already gave you. So I would like to go and do documentation for the medication that I just gave to my patients. So for the documentation, I want to write down the date. Today is 18 February 2020. The medication digoxin, and the amount is 0.1205 milligrams and per mouth. The time I give us is 4:40, and my initial. The second medication is insulin. I with the date, NPH 18 unit, and sub-Q abdomen site, and my initial. Okay. The third medication is regular insulin. Eight unit. Sub-Q abdomen. SN. For the sliding scale, I did give her 8 unit extra of regular because her sugar level is 325. So cute. Abdomen. Influenza also. Influenza vaccine. 0.5 milliliter IM deltoid. DPSN. Okay. Okay, I make sure to write my initial and my full name. And this is my documentation. So for the I would like to do a report SBAR for my patients. So my patient is my patient's name is Elsa Sutter, and her date of birth is March 1940. She is 80 years old. Her vital sign is heart rate. Heart rate is 134 and 86. Pulse is 84. Respiration is 16. Oximetry is 98%. Temperature is 101.4. Her blood sugar is 352. That is her blood sugar. And for situation, that is situation, and then her background, she have my patients have infection, diabetic, also diabetes, osteofibrillations, and GERD. She admitted to the hospital yesterday because of the infected diabetic ulcer, her right, and then on her right heel. For assessment, I gave her digoxin 0.125 milligrams of digoxin. Insulin, I give her 34 units. I also give her influenza 0.5 milliliter on her deltoid. I didn't give her cephalexin because she have allergy with penicillin, and this medication is not for patient that have penicillin allergy. And I will contact the pharmacist to have further information. And I complete my medication administration.